Which of the following is true regarding OPV and IPV? A. OPV is heat stable and stored at +2 degrees Celsius to +8 degrees Celsius indefinitely. B. IPV must always be frozen to preserve potency. C. OPV is live attenuated and given orally, while IPV is inactivated and given intramuscularly. D. OPV provides stronger immunity than IPV, but carries no risk of vaccine-associated paralytic poliovirus.
The correct answer is C. OPV is live attenuated and given orally, while IPV is inactivated and given intramuscularly.
The current OPV used in Nigeria for routine immunization is A. Trivalent OPV, TOPV, B. Bivalent OPV, BOPV, C. Monovalent OPV, MOPV, D. Hexavalent OPV.
The correct answer is option B, bivalent OPV, BOPV. Nigeria, along with most countries, switched from trivalent OPV, TOPV, to bivalent OPV, BOPV in April 2016 as part of the global polio eradication strategy. The trivalent OPV previously protected against types 1, 2, and 3 polio viruses, but it was withdrawn because type 2 polio virus was declared eradicated. The bivalent OPV, BOPV, now protects against types 1 and 3 polio viruses and is the vaccine currently used in Nigeria's routine immunization. The monovalent OPV, MOPV, is designed to protect against a single type of polio virus and is used only during specific outbreak responses. There is no vaccine called hexavalent OPV, as such a formulation does not exist. Therefore, the oral polio vaccine currently in use for routine immunization in Nigeria is the bivalent OPV, BOPV.
A newborn should receive the first dose of hepatitis B vaccine, Hep B0, within 24 hours of birth, 6 weeks of age, after 2 weeks of birth, only if mother is hepatitis B surface antigen or Hep B.
Correct answer is B. Within 24 hours of birth. The first dose of hepatitis B vaccine, Hep BO, also called the birth dose, should be given as soon as possible after birth, ideally within 24 hours. Key points to note: this early dose helps prevent perinatal, mother-to-child transmission of hepatitis B. It is recommended for all newborns regardless of the mother's hepatitis B surface antigen status.
The pentavalent vaccine contains all of the following except A. Diphtheria toxoid, B. Pertussis vaccine, C. Hepatitis B vaccine, D. Rotavirus vaccine.
Correct answer is D. The pentavalent vaccine used in Nigeria's routine immunization schedule protects children against 5 diseases. Diphtheria toxoid protects against diphtheria. Pertussis vaccine protects against whooping cough. Tetanus toxoid protects against tetanus. Hepatitis B vaccine protects against hepatitis B. Haemophilus influenza type B protects against HIV meningitis and pneumonia. Therefore, the correct answer is D. Rotavirus vaccine. 5. Pentavalent vaccine contains all of the following except diphtheria toxoid, B. Pertussis vaccine, C. Hepatitis B vaccine, D. Rotavirus vaccine.
The pentavalent vaccine protects against 5 diseases, namely diphtheria, pertussis, tetanus, and hepatitis B, and Haemophilus influenza type B or HIB. The rotavirus vaccine is not included in the pentavalent vaccine. It is a separate oral vaccine given to prevent severe diarrhea caused by rotavirus infection.
6. Which of the following statements is true regarding the pentavalent vaccine? A. It is administered intradermally at birth. B. It is given orally at 6, 10, 14 weeks. C. It is given intramuscularly in the left thigh at 6, 10, 14 weeks. D. It is administered subcutaneously at 9 months.
The correct answer is C. It is given intramuscularly in the left thigh at 6, 10, 14 weeks.
7. Which of the following vaccines is not freeze sensitive and can safely be stored in contact with ice packs? A. Hepatitis B vaccine. B. Rotavirus vaccine. C. Oral polio vaccine (OPV). D. Pentavalent vaccine.
The correct answer is C. Oral polio vaccine. Understanding which vaccines are freeze sensitive is important for proper storage and to maintain potency. Hepatitis B vaccine inactivated. No. Freeze sensitive. Freezing damages the antigen. Rotavirus vaccine live oral. No. Freeze sensitive. Must not be frozen. Pentavalent vaccine combination includes Hep B. No. Freeze sensitive. Freezing destroys potency. Oral polio vaccine OPV. Live attenuated. Yes. Not freeze sensitive. Can safely be stored frozen or in contact with ice packs. OPV is not freeze sensitive and can safely be stored in contact with ice packs. Correct answer is C. Oral polio vaccine. 8. A refrigerator in a health facility recorded a temperature of -1°C for 2 hours. What is the most appropriate immediate action for the health worker? A. Adjust thermostat to make refrigerator cooler. B. Carry out shake test on freeze-sensitive vaccines and report to supervisor. C. Leave vaccines in refrigerator and continue normal use. D. Discard all vaccines immediately.
The correct answer is B. Carry out shake test on freeze-sensitive vaccines and report to supervisor. A reading of -1°C means the temperature dropped below freezing, which can damage freeze-sensitive vaccines, e.g. hepatitis B, pentavalent, penta, TD, TT. Appropriate immediate action. Do not use or discard the vaccines yet. Perform a shake test on all freeze-sensitive vaccines to check if they were frozen. 9. What is the maximum period that vaccine carriers can normally maintain recommended temperatures during outreach sessions? A. 2 to 4 hours. B. 6 to 18 hours. C. 24 hours. D. 2 to 7 days.
Correct answer, B. 6 to 18 hours. Vaccine carriers are insulated containers used to maintain vaccines at the recommended temperature, +2°C to +8°C during outreach or field sessions. When properly packed with conditioned ice packs, a standard vaccine carrier can maintain the required temperature for approximately 6 to 18 hours. 10. A vaccine vial monitor, VVM, attached on the cap of a vial indicates what rule for opened multi-dose vials? A. Can be used for up to 28 days if VVM is valid. B. Must be discarded after 6 hours or end of session. C. Can be used until expiry date if kept cold. D. Can be restituted and reused within 12 hours. The correct answer is A. Can be used for up to 28 days if VVM is valid. The Vaccine Vial Monitor, VVM, is a small label attached to vaccine vials that changes color gradually when exposed to heat. For opened multi-dose vials, open vial policy, certain vaccines that contain preservatives such as OPV, IPV, Pentavalent, Hepatitis B, and TD may be used for up to 28 days after opening if all these conditions are met. The VVM is still valid. Not reached discard point. The expiry date has not passed. The vial has been kept at +2 degrees Celsius to +8 degrees Celsius. Aseptic technique was maintained during use. However, reconstituted vaccines like BCG, measles, yellow fever must be discarded after 6 hours or at the end of the session, whichever comes first. 11. The shake test is carried out to A. Detect cumulative heat exposure of vaccines. B. To check whether freeze-sensitive vaccines have been damaged. C. To test potency of live vaccines. D. To determine light sensitivity of vaccines.
The correct answer is B. To check whether freeze-sensitive vaccines have been damaged.
12. According to Nigeria's National Vaccine Supply Policy, what is the recommended supply period for vaccines at health facility level? A. 1 week. B. 2 weeks. C. 4 weeks. D. 8 weeks. The correct answer is C. 4 weeks. According to Nigeria's National Vaccine and Logistics Supply Policy and the National Primary Healthcare Development Agency guidelines, the recommended vaccine supply period for health facility level is 4 weeks, 1 month. This means each health facility should receive enough vaccines and diluents to last 1 month based on target population and expected consumption. 13. When reconstituting vaccines, such as BCG, measles, or yellow fever, which principle is correct? A. Any diluent can be used if from a sterile source. B. Diluent should always be from the same manufacturer as the vaccine. C. Diluent should be used at room temperature. D. Vaccines can be reconstituted several hours before use if kept cool.
Here the correct answer is B. Diluent should always be from the same manufacturer as the vaccine.
14. A caregiver objects to vaccination of a mildly sick infant with low-grade fever below 38.5 degrees Celsius. According to guidelines, the health worker should A. Respect the caregiver's objection and postpone vaccination indefinitely. B. Explain that mild illness is not a contraindication and vaccinate the infant. C. Give only oral vaccines and defer injectables. D. Refer the infant to hospital for clearance before vaccination.
The correct answer is B. Explain that mild illness is not a contraindication and vaccinate the infant.
15. Which vaccine is given last when multiple injections are administered to an infant during the same session according to WHO guidelines? A. Oral polio vaccine, OPV. B. Rotavirus vaccine. C. Pentavalent vaccine. D. The order depends on caregiver's preference. The correct answer is A.
Oral polio vaccine, OPV. According to World Health Organization and Nigeria's National Routine Immunization Guidelines, when multiple vaccines are given to an infant during the same visit, injectable vaccines like Pentavalent, PCV, IPV are given first. Oral vaccines like OPV and rotavirus are given last, especially OPV, in order to prevent spitting or vomiting before other vaccines are administered.
16. During IM injections in infants under 12 months, which of the following is correct? A. Use the deltoid muscle because it is more accessible. B. Give all injections in one thigh, regardless of number. C. Use both thighs for 3 injections. 2 can be given in one thigh, separated by 2.5 centimeters. D. Aspirate before injection to prevent intravascular delivery.
The correct answer is C. Use both thighs. For 3 injections, 2 can be given in one thigh, separated by 2.5 centimeters. For infants under 12 months, the recommended intramuscular injection site is the anterior lateral thigh, the vastus lateralis muscle. Key WHO and NPHCDA guidelines. Site: the anterolateral aspect of the mid-thigh, safest and most developed muscle in infants. If multiple IM injections are due, use both thighs. If 3 injections are needed, 2 can be given in one thigh, separated at least 2.5 centimeters to avoid local reaction overlap. Do not use the deltoid muscle in infants less than 12 months because it is too small and increases the risk of nerve injury.
17. According to WHO multi-dose vial policy, which of the following must be discarded within 6 hours or at the end of the session, even if not fully used? A. OPV. B. Hepatitis B vaccine. C. Reconstituted measles vaccine. D. Pentavalent vaccine.
The correct answer is C. Reconstituted measles vaccine. According to the WHO multi-dose vial policy (MDVP) and Nigeria's national immunization guidelines, vaccines fall into 2 categories regarding how long they can be kept after opening. 1. Vaccines that can be kept for up to 28 days after opening, if VVM valid, aseptic technique maintained, expiry date not passed, and stored at +2 to +8 degrees Celsius. These contain preservatives: OPV, IPV, pentavalent vaccine, hepatitis B vaccine, TD/TT. 2. Vaccines that must be discarded within 6 hours or at the end of the session because they are reconstituted and contain no preservative: BCG vaccine, measles/MR vaccine, yellow fever vaccine. Therefore, C. Reconstituted measles vaccine must be discarded within 6 hours or at the end of the session, even if not fully used.
18. At the end of an immunization session, unopened vaccines with acceptable VVMs should be A. Returned to the use first box in the refrigerator. B. Discarded immediately. C. Kept in the vaccine carrier until next session. D. Stored at room temperature for up to 24 hours. At the end of an immunization session, unopened vaccine vials that have not passed their expiry date, have acceptable vaccine vial monitors, and have not been exposed to freezing, if freeze sensitive, should be returned to the use first box in the refrigerator. The use first box ensures these vials are prioritized for use in the next immunization session, minimizing wastage. 19. The most appropriate action for health workers when preparing a defaulter tracking list is A. Record only those who have completed the full schedule. B. List infants who missed their session and mobilize them through community helpers. C. Wait until monthly reports are compiled to track defaulters. D. Inform caregivers only if 2 or more sessions are missed.
List infants who missed their session and mobilize them through community helpers. Explanation: when preparing a defaulter tracking list, health workers should identify infants or children who missed their scheduled immunization sessions, record their names, addresses, and contact details, work with community volunteers, mobilizers, or health promoters to reach and remind caregivers to bring their children for vaccination. The goal is early follow-up, not waiting for monthly reports to ensure no child is left unimmunized.
20. In monitoring immunization performance, a health facility recorded pentavalent 1 coverage of 85% and a dropout rate of 15%. According to national policy categorization, this health facility falls under which category? A. Good access, good utilization. B. Good access, poor utilization. C. Poor access, good utilization. D. Poor access, poor utilization.
Good access, poor utilization. Immunization performance is evaluated using 2 key indicators. 1. Access is measured by Penta 1 coverage. So good access is when Penta 1 coverage is greater or equals to 80%, but poor access is when Penta 1 coverage is below 80%. Secondly, utilization of vaccine is measured by the dropout rate. And dropout rate is how many children did not complete Penta vaccination from Penta 1 to Penta 3. Good utilization is when dropout rate is less than 10%. That is, the total percentage of children who did not complete Penta vaccination from Penta 1 to Penta 3 is less than 10%, while poor utilization is when dropout rate is greater or equal to 10%. In this case, Penta 1 equals 85%, good access. Dropout equals 15%, poor utilization. So the facility falls under good access, poor utilization.